Hi, I'm Dr. Bojack from Atlantic Chiropractic in Stoneham, Mass, your posture doc. Today we're going to talk a little bit more about organs and tissues, particularly the pumper muscle, which is your heart, right? Which is literally a muscle, but it's heart muscle. And that heart muscle is a little more unique and distinct, but it's a muscle, okay? And the other organ we're going to talk about is the lungs. Okay, so I'm going to use bags here for your lungs. Okay, and guess where they're all located is in your chest or your sternum or your thoracic cage. Okay, so we're going to talk how posture can affect the functional integrity of these lungs. Okay, which obviously exchange your oxygen or ventilate the oxygen in your body, and this pumper muscle, which is your heart, which controls the actual blood flow in your body. All right, so the posture can affect your heart, which is your pumper muscle, or those lungs, right? Both of those organs are located in this thoracic cage, your rib cage, your sternum, okay, your chest, call it whatever you want to call it, okay? So what postural distortion that we're going to talk about specifically is this rounded shoulders, okay? And we often call this camel hump, buffalo hump, gargoyle hump, okay? Rounded shoulders, whatever you want to call it, okay? You see this more and more prominent in what? Older age people. As they get older, they get more sedentary, and as they get more sedentary, what are they doing? Sitting more, and as they sit more, they're less physically active. So what happens is the muscles start to weaken and the posture starts going back to that original fetal C position, which is that rounded shoulders, right? So we're born in that fetal C position. So the secondary curves, which are neck and low back, start to weaken. The head starts to go forward. The shoulders start to go forward. Now, as the head goes forward, as you can see, right, the chin starts to jut out. So the head's forward, and you can see that by the prominence of the chin jutting out. And then the shoulders start to move forward. And then what happens is this pleural cavity, or this thoracic cage, starts to what? Close down. And as it closes down, it creates what? Resistance to this pumper muscle and to these lungs, right? Again, understand what's going on, right? Real simple. These bags have to inflate, right? So they inflate, and it's in this actual space that they're inflating. Well, what happens when your space starts to decrease because this cage is starting to close down? It starts to what? Put pressure on those lungs. So a common conversation with people is, you know, doc, when I really start to get stressed, I feel almost like anxiety, like somebody's stepping on my chest, or a foot's on my chest. Seems like I can't catch my breath, or I can't take a full deep breath. Okay? So again, practical sense says that if this cage goes forward, it's going to collapse. As it collapses, the space gets what? Smaller. And as it gets smaller, the organs get more challenged because what? There's more pressure, resistance, or tension on that pumper muscle and on these lungs. Consequently, it's more and more challenging for those lungs to what? Open up and expand as they take in oxygen. And the same thing's going on with that heart muscle, right? It's got to contract and then what? Relax. Contract and relax. But it also needs space. So any kind of tension on those two organs is going to create more and more irritation. Okay, so looking at the spine, I apologize, I should have the rib cage. We'll get one of those. But right now we have to work with what we have. So the head goes forward, the shoulders go forward, And from a lateral or side picture, this whole torso's what? Head forward, head's jutting out, it's going forward, the shoulders are rolling forward, so this whole rib cage is starting to collapse. So we look at this rib cage from an A to P dimension, again, right? The lungs are sitting in there, the heart's sitting in there. These lungs, this space starts to collapse as the head goes forward, shoulders go forward, and these ribs are starting to get jammed into the sternum. So in regards to this, just the mechanics of this rib cage and this chest or the sternum as far as the osseous or bony structure. So here's your rib heads, here's your sternum. So these are actual rib joints that are going into the sternum, right? So literally with breathing, right, your rib cage should roll, these ribs should roll up, and inspiration, and then with expiration, the ribs should roll down, okay? But when you got this postural distortion, those ribs are getting jammed into that actual sternum, so they're not moving. And a lot of times these will even get frozen with that scar tissue or that glue, or even arthritic conditions. So it's not uncommon when we start bringing these shoulders back and this rib cage back that you actually hear some audibles or sounds as these rib heads start to release or even popping. Nothing abnormal. It's just literally a release in of these joints and motion starting to get established in that rib cage. Again, it's all about energy, right? If you're burning so much more energy because you got to fight through these ribs that aren't moving up and down because this cage is so forward, or you even have arthritic conditions in here, it's going to agitate the functional integrity of your ventilation. And then we have what? We have the clavicles up here that you can't see, but they're the same thing, right? These clavicles should be rolling and moving too. But if the shoulders are rolled forward, the actual shoulders start to freeze also. And as far as I'm concerned, most shoulder problems start with postural distortions, especially with these rolled shoulders. You get impingement on the capsules, and the shoulders start to dysfunction, but they start to dysfunction first because there's postural distortion and these capsules getting impinged. Okay, so it's not uncommon when we start adjusting A to P through this thoracic cage and we get the shoulders come back, you feel this movement and release in your rib heads, and then you feel releases in these capsules in your shoulders, and even in the clavicles you get movement. Okay, and how important is it for you to ventilate yourself more? Okay, when we increase ventilation, what happens? More oxygen equals more energy. So if we could bottle energy and sell it, right, you couldn't keep it on the actual shelf long enough, right? But essentially that's what's going on. When we bring this head back and the shoulders back, okay, that chest opens up and you start to breathe because the functional integrity of the ribs, of the sternum, of the actual shoulder capsules increase as a consequence to that. Okay, now in regards to what? Actual braces and straps and all this other stuff out there. Okay, I do not like them because once you start wearing them more, what happens? Those braces and straps and supportive mechanisms start doing the work of your musculature and of your structure. So what do you think starts to happen? You start to weaken. So now that doesn't help this posture. It starts to what? Create even more of this. As soon as you take those braces off, you're creating more problems here as far as your breathing and as far as that actual heart muscle pumping. So I do not like those braces. You're better off working the structure, using the structure that should work like it needs, right? The only reason that structure is not working as far as this sternum and those lungs breathing and the heart pumping is because mechanically there's postural distortions. And you got to take care of the postural distortions so you establish normal movement. These braces, these support mechanisms, these straps are just Band-Aids. That's all they are. And those Band-Aids, when you're not using them, create a bigger problem Because like I said, right, this sternum, this chest, your pec major, pec minor, your trap muscles start to get weaker and weaker and weaker, right, which creates more dysfunction in this sternum. So again, right, what happens next, or the progression here, is from the what? Osseous or bony structure to the muscular structure. Okay? Again, let's go back to what controls this muscle is neurology, right? Neurology controls the tone of the muscle. So if you're starting to get this distortion going on and you don't have any movement in there and you're starting to get less and less motion, these muscles are starting to get more rigid and more tense and more spastic, which is going to what? Add or subtract from your current condition, right? It's just going to add to it. It's just going to create more problems, because now we got an osseous or bony structure that's not working, which is irritating the neurology. And then the next layer we got is the musculature. So now we got the musculature that's irritated, and the osseous or bony structure, skeleton, that's irritated, and that's all irritating that neurology. Okay? So these intercostal muscles are getting irritated, right? These lat muscles are getting irritated. The external obliques, the internal obliques, the abdominals, the trap muscle, the scapularis muscle, the levator scapular muscle, all these muscles are starting to wind up. Shoulders are starting to go, and it's just, again, it's a compensatory response to these postural distortions. So you're going to go in there and you get a massage, right? I have nothing wrong with a masseuse, nothing wrong with that, but just understand what's going on, right? You go in there and get massage, you feel great, and then you get up off the table, and as soon as you stand up off the table, what do you have? Vertical gravity pushing down. And as soon as you have vertical gravity pushing down, what happens? You return to your postural distortions. Okay? So that's why it feels great, right, after you get a massage, but it doesn't last for a duration of time, because, again, vertical gravity is changing these posture, and neurology is controlling muscular tone and tension. Okay? Yeah, when we change the mechanics and we create the motion in there, now you can go in there and start let yourself start getting massage and stretching out those muscles and massaging those spasms out of there. And now they're going to hold, because the posture is going to assist or support that new length of the muscle and the relaxed position of the muscle, right? It's no different than exercise, right? If the mechanics of the spine is only this movement, that's the only movement you're going to take it through when you're exercising, versus it should be this kind of movement, right? I mean, it's a great thought, but again, just understand the progression. Now, we look at the A to P picture, right? Or the anterior to posterior, or front to back picture. What do we got? We got this pec muscle, right? We got pec major, we got pec minor, right? So we got two muscles here. We got the lat muscles, right? We got the deltoid, anterior delt, posterior delt, and we got the SCM muscles. We got the trapezius, upper and lower trapezius muscles. So same thing. All these guys are starting to get affected. So that's the anterior portions. So again, you have to look at the structural integrity in regards to the layers. Okay? Again, it's inside out, it's not outside in. Okay? So we want this, so same thing, right? For you to ventilate, these shoulders got to be back, the head's got to be back, these pec muscles got to open up and stretch. Okay? These upper trap muscles got to open up, even the abdominal muscles. And again, right? Same thing, you guys who meditate or you're into breathing, right? We should be breathing from our soleus muscles. Okay? But in most instances, there's no way in heck you're going to breathe from your soleus muscle down here when you have this posture. So you're breathing from the top of your sternum. You're just taking these short, choppy breaths. And that's why I'm sharing with you these short, choppy breaths almost leading to anxiety, because it's almost like you can't get enough air in there. And you can't, not with that mechanics. Right? Like, it's almost impossible. And if you're going to somebody who's saying you should be breathing like this, and they show you how to breathe, when you're trying to breathe from down here, it's really challenging. Why? Because the mechanics don't dictate for you to breathe normal from the solus, because you've got this torso going for. It's almost like you can't get from here to here if you have this kind of postural distortions going on. Make sense? It's all practical, right? Just think about it. It just makes practical sense. I want it to be practical. I want it to be simple so you can put it together and connect the dots. You know what? Your health, no matter how you look at it, the bottom line is it's your responsibility. You have to understand it for you to address it. And here's the beautiful lungs, right? So we're looking at the side. So obviously you're only seeing one of the lungs, but obviously you got two of those bags in there, right? And remember, right, those lungs have to what? Inflate. And they can't inflate if the space of that sternum or the chest is what? Compressing or decreasing, because there's no place for it to actually inflate. So it gets more and more difficult. So that's, as I said, that's why you end up with these short, choppy breaths, or you feel yourself breathing from the top of your sternum versus down here in your solar plexuses. Okay? It's not your fault. Your body, again, goes back to what? Adaptation. It's doing the best it can with the environment that it's given. So it can't take a full deep breath, so it has to go with short breaths. And since it's not getting the amount of ventilation or oxygen from the short breaths, then it has to what? Increase your rate of breathing. So you're breathing quicker, faster, and consequently your conversation is, I can't catch what? My breath. Which makes sense, right? Since you're taking these short, choppy breaths, you just can't feel like you're ventilating or breathing enough of oxygen to support your actual machine or your body in regards to its functional integrity. Especially when what? You're doing a lot of physical activity. So you're moving things around, right? Or you're walking a lot, okay? Or you're trying to walk quickly to get someplace. So as you increase your physical exertion, you notice that more and more. You might, your co-partner might say, gee, you're breathing heavily. Why? Oh, well, it always happens, especially, it seems like I can't catch my breath, but when I do a lot of physical exertion, it's even more predominant. Again, right? It's not the problem with the organs, the heart or the lungs. It's the problem with the machine and the actual mechanics of this skeletal structure and the neurology. Last, right, this pumper muscle. So in regards to this heart, same thing, right? This heart is in that rib cage or that sternum or chest, right? It's got a pump, okay? Yes, the consistency of this heart muscle is a little different than the lungs, but it's, again, the same distinction. It's got to expand and contract, and the more space it has with less resistance, less tension, the better it's going to function in regards to filling up that muscle and increasing the muscle and decreasing the muscle with the contractions. So again, pumping that blood throughout your body. Okay? That pressure or resistance on that sternum, because your shoulders are rolled, is just going to cause that much more tension on that heart. It might be the cause of your palpitations or a change in that heart rate. Because of it, it's got to compensate. Again, body's always compensating. It's always dealing with what it has for the environment so it can adapt the very best it can to perform what it needs to perform. Right? And again, there's only one intelligence. It's your intelligence. It knows exactly what you do. It knows your physical, mental, emotional, chemical stresses, and it knows even when you're standing against vertical gravity or not standing. Knows what you eat, knows what you drink, knows how much you sleep, knows when you work, knows when you play. And it's always adapting accordingly. Right? It's always asking, where am I in regards to the environment, and where is the environment in regards to me? Okay? So again, we'd love to check you. This is real common, this postural distortion, these rolled shoulders, this head going forward, that chin protruding forward, and it really causes these irritations. It's really common as we start changing these postures. People start saying, "Doc, you can breathe easier. I just feel like I got a better breath. I'm starting to feel more energy." Right? Just stands to reason. Again, I don't correct anything in here. It's your neurology, your intelligence that adapts and corrects. All we do as chiropractors is turn on the switch so that neurology can express at 100% because it knows exactly what it needs to do. A hell of a lot better than I do, that's for sure. Oh, by the way, you know what? I love doing these actual YouTube clips. Please, okay, show me a little love also. And if I could graciously ask you to subscribe to my YouTube channel, I'd really appreciate it. Okay, so I can get this conversation, the truth out to you guys, and we can help some people. So I'd really appreciate it if you can help me, and you can subscribe to our YouTube channel. Listen, thank you so much for giving me the time and the energy to sit and watch our video. I know it's the most precious thing we have, so I thank you from the bottom of my heart. We'd love to check you at Atlanta Chiropractic. You can call us at 781-GET-WELL, 781-438-9355. And remember, right, the power that made the body heals the body. It didn't leave us. It still works. It's still balancing us 24/7. Not working some of the time, working all the time. God bless. Have a great night.